All right, we're glad you're all here today. Thanks to Joe and Sharon for joining us. And we understand that Sharon's going to kick things off. Sharon spent nearly 30 years in the field of healthcare and gerontology. She served as director of a county aging program in Ohio and as executive director of a guardianship agency. She spent over 7 years supervising senior and clinical services with an international employee assistance program, and currently she's, as her title shows, geriatric care manager, aging life care specialist, and volunteer for SAGE. And SAGE, Central North Carolina, I understand Joe and Sharon will tell us more about their organization. I'm trying not to go too long on the intro, so we'll leave that as part of the presentation. And Joe says he's worked over 30 years in this field. He says, and he can probably give us a little more background, but he discovered his voice fighting for LGBT rights during the height of the HIV epidemic after realizing there was a lack of care and concern for the community. He also advocates for people of color and leads anti-racism conversations. Joe tells us the conversations he and others are having about discrimination give him hope for changing the future.
Good afternoon. It's great to be here.
All right, we'll pass the floor to Sharon.
Very excited to be here. I was really excited when you reached out originally to Les Geller a few months ago, because my passion is Rotary International. Many years ago, more years than I would like to really talk about, I was a Rotary International scholar, and I did an international postgraduate at Dublin Trinity College with a focus on international law. So Charlie's picture of the Cliffs of Moher is very relevant to me. So I was fortunate to spend a full year in Dublin and traveled all over as a Rotary ambassador to, at that time, Southern and Northern Ireland. Also had opportunities thanks to Rotary International clubs, to go to Rotterdam, Germany. And then, of course, when I returned, I was sponsored by an Ohio club and traveled all over kind of the Midwest, talking about my experiences. So Rotary is near and dear to my heart, so it's great to be back. So we were very excited about this. I do coordinate education and training for SAGE Central North Carolina. Joe is a past volunteer in many capacities with SAGE and currently sits on our planning team, is very involved with education and training. So that's why I was very pleased that he could join us today and do this discussion with you. And that's what we hope it will be. As Joe has indicated, he has 30 plus years of experience with diversity training for many organizations and companies. So we hope that this brief presentation, and we do encourage questions at the end, will allow you to get a good view of the LGBTQ plus community and its issues around aging. Joe?
Great, thank you, Sharon. So if we could go back to the view without the PowerPoint. So we can see each other's faces. So I have good news. I have no PowerPoints. I have lots of information and no PowerPoints. So today I'm hoping in the about 30 minutes that we're going to be talking before we do question and response to lay down two sets of information that we think are important when you think about LGBTQ plus aging. The first is, what is the experience? And the common phraseology now is the lived experience of LGBTQ folks. And then talk about some of the impact, some research that has been done as to what are the concerns specific to LGBTQ plus folks as we age. So I'm going to go through some information about a timeline about my experience. And what I'm going to say is that my experience is that there's a whole set of societal experiences that we as LGBTQ folks pay attention to that are not always do not always have the same significance to our non-LGBTQ colleagues. So this is just to give you an idea of the kinds of things that have impacted me. Later this year, I'm going to be 70 years old. So I was born in 1951. So I'm going to go by decades. In the 1940s, in the 10-year period before I was born, that was when the military first banned gays and lesbians from serving in the military. Now you think back, what was happening in the early 1940s? It was World War II. And what happened was, particularly boys, some women, nurses and such, but it was at that time, the guys on the battlefield came out of our small towns, and we discovered that there were other people like us, where many of us had lived hiding our sexual orientation. And during World War II, we found that we were not alone. And that's when the government banned gays and lesbians from serving in the military. Now, in my first 10 years, when I was just a kid, that was when the American Psychiatric Association added homosexuality to its list of medical disorders. That happened in the 1950s. At that time also, immigrants were banned from entering the US because they had a psychopathic personality. So if you were gay or lesbian, you were determined to have a psychopathic personality and could not immigrate into the United States. Now, then I get into my teen years in the 1960s. And here's what I'm going to ask you to do. I'm going to ask everybody to in the chat, just type a Y or an N to the following question. If you knew who Bayard Rustin was, type a yes. If you don't know who Bayard Rustin was, type a no. Okay, I'm seeing a lot of no's show up. Bayard Rustin is an icon to LGBTQ folks. Bayard Rustin was the right-hand person to Reverend Martin Luther King Jr. He is the person who introduced Reverend Dr. King to the whole idea of anti-violence and peaceful protest. He also, Reverend King was approached by the FBI and told that in 1963, if he went ahead with his march, they were going to out him as an associate of a gay man, an African-American gay man. And Reverend Dr. King said, I'm just going to paraphrase, go ahead. Bayard Rustin organized the 1963 March on Washington, and yet his name is often left off our history. That's an example, as you might imagine, for LGBTQ folks, when we see our history erased. Ours is not the only subordinated group who have had their histories erased. Christine Jorgensen came out because of her sexual reassignment surgery, and pretty much everybody in the society heard about Christine Jorgensen. Also, at that time, the National Organization for Women was building up its civil rights progression. And my guess is that some of the folks here might have even been involved with NOW. It was at this time that NOW started to try to separate itself from its lesbian members because they thought the lesbian members gave the women's rights movement a bad name. Illinois in the 1960s became the first state to decriminalize homosexuality. So you can imagine that throughout the United States, if you, and this particularly had to do with having sex, but if they could identify you as homosexual, you might have some legal ramifications. People probably know 1969, that was the year I graduated from high school. That's not what you're supposed to know. What you know is the Stonewall Rebellion. That was also the same year as Woodstock. Some of you know about that one too. But in Greenwich Village in June was a moment when 3 days of protest were set off. I think it's important for us to remember that what is heralded as the gay rights movement started with a a protest, started with street action. It was in the 1970s, in 1973, that the American Psychiatric Association finally removed homosexuality from its list of mental disorders. And that's important because up to that time, if you were identified as gay or lesbian or bisexual, and we can include transgender, though people who are transgender actually have a different course with the American Psychiatric Association. If you could be identified before that time, your family could have you interned against your will, and you could be given shock treatments to try to cure you of your homosexuality. Transgender persons continue to be diagnosed with gender dysphoria, giving them a DSM, whatever number at that time, diagnosis. You might remember that Harvey Milk was assassinated along with Mayor Moscone. What you may or may not know is that the defense of the person who assassinated them was that he had eaten too many Twinkies and he had had a sugar overdose. And that was the defense, and he got off. Ultimately, he committed suicide. In the 1980s, I was in my 30s at that time. So imagine, remember when you were in your 30s? Remember how wild you were in your 30s? Okay, yeah, I see a couple people smiling. In my 30s was when HIV disease was diagnosed. It was first called gay-related immune deficiency because it was identified primarily on the coast, first in, I think it was New York, then in LA, as clusters of people who were having Kaposi sarcoma, a cancer that was unexplained. It was first called GRID, gay-related immune deficiency. And this is, as was mentioned, this is when I began to find my voice as being a voice for change. And that was because I saw that my colleagues were dying, my colleagues were getting sick. We couldn't get the president to even say the word AIDS. We couldn't get the pharmaceutical companies to move their research forward. And what you saw was a street action, people coming together, act up, speak out during that time. It was also a time when we began to see lesbians and gay men coming together because it is the women who came together to support many of my colleagues who were sick and dying at that time. Let's see. Oh, the Gay Olympics. I want to talk about the Gay Olympics because I think that's an important indication of our experience in society. In the 1980s, a group came together and organized what they called the Gay Olympics. And for a number of years, that was the only Olympics that was ever sued by the Olympics Committee because they thought it was a slur on the Olympic Committee to add the word gay. Now, I want you to remember, we have a Junior Olympics, we have a Special Olympics, we have an Eskimo Olympics, we have an Olympics of the mind. They've even had Olympics for rats and cockroaches. Now, to date, we are not the only organization that was sued by the Olympic Committee to not be able to use the word Olympics. We were the first, and at that time, the only. That's an example of the response that gay folk, queer folk, LGBTQ plus folks have lived with. That becomes a part of our lived experience when we get messages like that, whether it's messages from our state legislature, from the federal government, from our healthcare organizations, et cetera. Let's see. Oh, 1940s. 1990s. I was in my 40s. Don't ask, don't tell, which was to rectify the number of dishonorable discharges from the United States military. And that was signed by Bill Clinton. And after Don't Ask, Don't Tell was signed into law, we saw more LGBTQ folks given dishonorable discharges from the military than before Don't Ask, Don't Tell. So it did not serve its purpose. The Defense Against Marriage Act, just by a quick show of hands, how many of you people remember when the Defense of Marriage Act was enacted? Yeah. That in 1996, what that said is marriage can only be between one man and one woman at one time. And so we were told that our relationships And in the 1990s, I had been with my husband at that time about 10 years. We now have 38 years together. At that time, he was not my husband because DOMA said he couldn't be. And then the Supreme Court determined in Amendment 2 in Romer versus Evans in 1996 that that Amendment 2 was unconstitutional. And what that allowed for was that we then could begin to realize some of our basic civil rights. Some people don't know that as long as we have not been able to be married, we were denied over 1,200 financial benefits offered to married people by the federal government. And again, that not only sends a strong message, that also puts us in a more precarious financial situation. And during the 1980s, there were some marketing groups that wanted to demonstrate that LGBT folks were a good marketing group. And so they did some research, and they predominantly did that through gay men's magazines like The Advocate to get people to respond. And what they found out was that gay folks had more money, had fewer children, had great pets, and that we therefore it was good to market to us because we had money. Now, I heard someone say that getting research around LGBTQ folks from soliciting through magazines, specifically for gay men, was sort of like trying to find out the financial situation of people who are African American or Black by only using Essence readers as your population. And so what we have found since then, that actually LGBTQ folks, for various reasons, whether it be denied in work, denied in federal benefits, et cetera, tend to have lower incomes than our heterosexual colleagues. How many of you remember Matthew Shepard in Wyoming? Yes, that was big news. Here's the thing I want you to know. Pretty much every LGBTQ person I know knew other people who had been bashed, beaten, killed, and that part of what we understood is that our physical well-being could be threatened. So while Matthew Shepard was a big deal societally, in my world, just for me, it was just another young gay man who was beaten, because I don't know a gay person, an LGBTQ person, who has not had something shouted at them from a moving vehicle that seemed to be physically threatening. Okay, then it was in the year 2000s, Lawrence versus Texas struck down the sodomy laws, invalidating sodomy across the nation. Now, what that meant was before that time, legally, the police could come into your bedroom and you could be arrested if you were involved in any kind of sexual activity with someone of the same sex or gender. So that was huge, because even though most of us didn't have the police break into our bedroom, there are a number of instances where the criminal justice representatives use the threat of that to involve people in the criminal justice system, like to the threat might have people report on others, et cetera. Massachusetts was the first state to allow same-sex marriage. And after they did that, 31 states passed laws banning same-sex marriage. So Massachusetts set it off, and then other states responded with the negative. In 2010, the 2010 census, they found out, because they asked questions for the first time, that there were LGBTQ households in 99% of US counties. So there is a message that San Francisco and Los Angeles and Provincetown and Key West are the centers for LGBTQ folks. Our families live in 99% of the counties. Don't Ask, Don't Tell was repealed in 2011. DOMA was struck down in 2013, so we could begin to receive federal benefits. Edie Windsor recently died. Edie Windsor, again, is one of the icons for LGBTQ people. It was her case that went to the Supreme Court. And one of the things, again, when you think about our experience compared to our non-LGBTQ colleagues, if you've ever had your civil rights determined by the Supreme Court, then that is something that you realize you may not expect civil rights given just by the nature of your being a human being. And I know that we share that with people with disabilities. We share that with people of color. We share that with people of other ethnicities, where the Supreme Court had to say that we deserved our civil rights. In North Carolina, marriage became legal in 2014. My husband's birthday is on October 21st. We were going to get married on that day because I knew that was the only way I could count on him to remember our anniversary, because it was on his birthday. We ended up getting married the day after because one of the people we wanted as a witness had a doctor's appointment. The Pulse nightclub massacre. Now, how many people, again, just show your hands, you've heard of the Pulse nightclub massacre? Okay. I'm going to ask you if you know this information, and you don't have to respond. Just think, did I even know this? It happened in June of 2016. 49 people were killed. It was Latin night at this dance club. 49 people killed, 53 wounded. It was the deadliest incident in the history of violence against LGBT people in the United States. It was the deadliest terror attack in the US since September 11th, and it was the deadliest mass shooting by a single gunman in the US history until the Las Vegas shooting. So again, if you are someone who is not LGBTQ+, you might know that we have a different relationship to the Pulse massacre because it was our tribe, it was our people. Those are just a number of the things to give you an idea of maybe the different experiences. Now, what does that mean? So I'm going to share with you some other information that comes out of research from SAGE USA and from AARP. I see that I have about 6 minutes, so I'm just going to hit some of the highlights. And I'm going to share the resources in the chat during the question and response period. So know that you'll be able to access some of this. So here are some aspects of the LGBTQ aging experience. And when I say twice as many or half as many, know that I'm comparing that to non-LGBTQ folks. As we age, we are twice as likely to live alone. More than 1/3 of our folks live alone compared to 1 in 5 non-LGBTQ. We are 4 times less likely to have children, and we are more likely to say that our support networks are growing smaller rather than larger as we age. I talk a lot of times to healthcare providers about the difference between horizontal support networks and vertical support networks. For people who have children and grandchildren, people of different ages, they are more likely to have a vertical support network, which means when you're 80, you might have someone who's 60, you might have someone who's 40, you might have someone who's 20 who's close to you. Many LGBTQ folks have what is a horizontal support network. My husband is a generation older than me. And so I tell him often that he is lucky that he married a young, hot number. So I'm in my 60s, he's in his 90s, he's a World War II vet. And so, as Sharon will tell you, because we talk often, I provide a fair amount of his caregiving. If he didn't have me, his only support network would be other people in their 80s and 90s. He sometimes says, who's going to take care of you? And the answer is, when I'm 80, I don't know, because most of my friends are going to be 80. 3/4 of us are concerned about having adequate family and social support networks. we are 5 times less likely to access senior services. That would be like our senior centers, that would be home health. For any number of reasons, we are much less likely to reach out. And the truth is because some of us have not had good experiences either with our healthcare providers or visiting nurses, or even like we feel isolated when we go to a senior center. 40% of LGBTQ folks over 60 are not out to their primary care physician. And I have to tell you, I have a great primary care physician and I feel like I can talk to him about anything, but I came to him because I fired my last doctor because of his response to my sexual orientation. We are dealing with homophobia, we're dealing with heterosexism, and we're dealing with ageism. A higher number of LGBTQ folks are worried about how we look, our physical attractiveness as we age, as our non-LGBTQ counterparts. We're much more concerned about having money to live on, our declining physical health, having to depend on others. We're more afraid than our non-LGBTQ colleagues that we have not saved enough money for retirement. For people who are transgender, because I want to be clear, even though as a white, gay, cisgender man, I realize that I have been used as the face for the LGBTQ community historically, and I want to make sure that we are including my transgender associates, my queer folks of color, people who deal with various kinds of discrimination beyond what I may experience. So for people who are transgender, 2/3 of transgender people feel that they will have limited access to healthcare as they age. 1/3 are determined that they will have to hide their gender identity so they can access suitable housing. More than half are concerned about verbal and physical harassment, limiting access to services, and neglect in long-term care. More than 50% are concerned they will have to hide their gender identity if they go into a housing complex, a long-term care facility, an independent living care facility, senior apartments, etc. 2/3 are concerned that they will not have adequate health care. 3/4 are concerned that healthcare providers will not be sensitive to their needs. And so last thing I'm going to mention is of all respondents, and I think this is key for professionals who provide services to aging folks. In the survey that was done by AARP, 80% of LGBTQ plus respondents said they would prefer to have providers who are LGBTQ. They also said, 80%, that they at least want their providers trained in LGBTQ issues, and that they look for affirming messages in signing and advertising, and that they look for LGBTQ signs displayed on site. And I'm going to give you a couple examples. The senior center in Orange County has a pride flag on the door. I love those folks. They're very LGBTQ affirming. For a while, my husband was on hospice with Transitions Life Care. Transitions Life Care provides a decal for every one of their employees. It is a pride flag. The nurse that came out to do the in-home assessment for hospice did not have her sticker on her badge. She took me out to the parking lot to show me that it was on her car right below her deadhead sticker. So, and I found them to be very LGBTQ affirming. When I walk into my doctor's office, one of the first things I notice is that there is a pride flag with the 6 pride colors that is posted in their waiting room. So those are the kinds of things that might make a difference. Now, I've given you a whole lot of information. I've talked really fast. I would be very happy to answer questions. I'm going to answer the question that's in chat, and then Sharon is actually going to handle the questions, and I'm going to support her. Is it true that many senior resources are passed not welcoming to homophobic, including residential facilities? If I understand that correctly, is homophobia over in our housing facilities? Is that pretty much it? That's pretty much it. I'm going to say no, 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 no. Here's one thing I tell folks in senior services. We treat everybody is not sufficient, because we treat everybody means you haven't thought about my issues sufficiently. You may not even know who Bayard Rustin was. You may not know the significance of the difference in the significance when Matthew Shepard was killed. You may not have thought about what the Pulse massacre means to me. You may not have thought about my isolation and how I am looking to connect with my tribe. And if I had a friend who was in an independent living facility, and I asked the staff, do you have any out LGBTQ people? And the answer was no, but we're sure that we're going to hire some given the hiring in our other areas. Well, they never got around to it. And I got to tell you, even a server in the waiting room who could be identified as someone that you might identify with as part of your tribe can make a difference. So what I would say is many organizations are working hard. SAGE provides education programs. We recently worked with the CCRC and did a 4-session, 1.5-hour Zoom class for their staff and residents. And so part of that education is helping prepare. But my experience is that unless there is an LGBTQ plus person in a position of responsibility in a facility, most facilities have not thought about our issues. So Sharon, I'm going to turn it over to you, and I'm going to, as much as I can.
Are there any other questions?
And please come off mute and feel free to ask your questions live rather than feel like you have to chat them in. And I'm going to begin to add some resources and files to the chat. You don't have to download them now. They'll be there for you before we end the program.
I think Suzanne Botts has a question.
I have a dear friend who's younger than I, and he is gay with a disability, and he lives in affordable housing. It has been just unbelievably difficult. I feel so fortunate that we have UNC and Duke nearby. He has HIV. He's been treated and successfully cured of hepatitis C, but it's so hard to find services, and he lives every day with people being very hateful and unkind, and I just feel for him. I'm his notification for emergencies, because it's hard, so terribly hard, as you mentioned, to find a person that can be your care. His family is, not there for him, disowned him sort of, but delightful person and wonderful friend. He's quite steadfast. I wish we could do more, and I'm just not quite sure if you could suggest how we can advocate.
Well, thank you for being his support. That is awesome. SAGE believes, and Joe and I believe strongly, that education and discussion and training is the road to making things different. And we've had some great conversations with providers here in Wake County over the last 2 or 3 years. And unfortunately, the pandemic has put us all in Zoom land for our educations and trainings, but we have continued to do that. And we continue to try to reach out to all types of living arrangements, as Joe mentioned, home healthcare agencies, adult daycare programs. So we are happy to do education. We're happy to help with advocacy issues. And SAGE Central North Carolina does serve We have connections all the way over to Greensboro, Burlington. We've gone as far east as Wilson and down to Fayetteville. So we are happy, and we're always happy to discuss with people if we can support. So if there's something we can do, Teresa can provide our contact information and we would be happy to help. I just wanted to add, when Joe was going through his history, when I said it was a long time ago for Rotary, this will give some of you a good feeling. And as I've looked at the participants today, it's kind of, it makes me feel good. But when I was a Rotary International Scholar, women were not allowed to be Rotary members.
Right.
And if women came, they were guests or spouses.
Oh.
So, and I don't feel like, while it was a long time ago, I don't feel like it was that long ago. So to see this many female Rotarians is very exciting, but it also tells us that change does come. And so the history that we've learned today about the LGBTQ plus community is important because we carry all of that with us.
Yeah, and Sharon, I want to add, Suzanne, I don't know if your friend, I think you said that he's younger. So Sage might not be the place where he would find a home, but the LGBT Center of Raleigh has an HIV support group. They have received training around disability awareness. So just contacting the LGBT Center of Raleigh and telling them that you're looking for resources and contacts for this young person might be valuable. That would be the first place I would start.
I have a question. Sharon and Joe, have you worked with Leading Age at all in North Carolina? Okay. And
Yes, we have.
and
We've met with them and we're very excited and they're a great resource as well.
okay.
We love our Leading Age. Tom is great. Yeah, doing great work.
Well, if you ever need any other information, I mean, I work in senior housing as a consultant and would love to find more ways to help with that.
Great.
If we can work together somehow,
Perfect.
please keep me in mind.
Other questions? I know I threw out a lot of information.
I have a simple question. There's a lot of initials, LGBTQ plus. Could you give us some definitions of what it is? Like the Q, is there certain people that belong in that stage? Can you help out?
Sharon, you take it or you can turn it to me, your choice.
And Joe, that's one of the attachments that you put in there was some of the definitions?
No.
Oh, okay. We do have a definition sheet, so we can get that to Teresa later. Yes, we use a lot of acronyms and we use a lot of phrases that may not be familiar. The Q is very much, no pun intended, questioning. It historically was queer. For a lot of our older adults, that is not a term that they are comfortable with. You heard Joe use it quite a bit, and he is fine with it. Many of our older adults are not. That was a pejorative as they were coming through, and they, just like some words that we hear in some of our other communities, it's not something that folks feel comfortable using. So just like with our pronouns, it's always best, and again, I know you've done enough diversity training here in this group. There is nothing wrong with asking the person that you're interfacing with, what do you feel comfortable with? How do you describe yourself? What pronouns do you use? And then they will be happy to tell you. But Queer or questioning is probably the two most prevalent for the Q.
Mhm. Okay.
And Sharon, I'd like to add a couple other things because there may be other letters that, so we know lesbian is about women who find physical and emotional attraction to other women.
Mhm.
So sometimes we stop at sexual and don't identify that. For those of you who are here heterosexual, you know that your heterosexual relationships are more than just physical. They are emotional. They're around attraction. Okay, gay, for me, I like to use gay only as an adjective. Like a gay man, or even talking about a gay woman, not talking about a gay. Oh, he is a gay. No, that would be a noun. So to use it as an adjective. Bisexual, finding physical, emotional attraction of people of both sexes. And today that has been expanded to all sexes and all gender identities. And I'm going to talk a little bit about gender identity in a second. So LGBT, transgender.
Mhm.
Transgender starts with the idea that there is a dichotomy, continuum from male to female, and people find themselves not on one end or the other, but somewhere in the middle. I remember I was working at Microsoft a few years ago, and there was a fellow, I was working with a group called Bill Gates Direct Reports, and they are the people who are hired to think the things you and I could never think, because they were the wildest group I've ever talked to. And there was one guy who was wearing a woman's blouse. His hair was long. He was wearing high-soled shoes, and this was like in the 2000s, and he had on pink Levi's. And so I had a chance to talk with him at lunch, and I said, I presume that you are a transgender person or a gay man. And he said, no, I'm a heterosexual man who just prefers to wear women's clothes. It was like, okay, cool. So transgender, male to female, somewhere. Now, the Q for some folks identifies queer, which means non-binary. And I'm gonna give you a real quick explanation of that, and then go look it up on Google, because I have to give you the quick definition. There are some, and you notice that I use they, them, and he, him pronouns. I use he, him pronouns because I know how I present, and people think of me as masculine, and I am a cisgender person. At the same time, I recognize that that whole female-male continuum is something we made up. It is a concoction of the human mind, and who we are as beings transcends a line between male and female. And so often there are, particularly young people say, my gender identity doesn't fit on that line, that it's spiritual, it's physical, it's energetic, it's holographic. And so many times we find people using they, them. As Sharon said, fewer older people use they, them unless they truly identify as off the gender continuum. Sometimes you see I is intersex. Intersex is a physical condition where people are born with chromosomes, hormonal, and genitalia differences that are not immediately identifiable, or that are identifiable as both sexes. So intersex is a physical condition. And then you might hear two-spirited. That relates to many of the Indian nations that treated people that we would identify as LGBTQ. They treated them as special people in the tribe. It was an honor to have a two-spirited person in your tribe. And then, of course, the Spanish came. They came with their Catholicism. They began to kill people, and two-spirited folks went underground. And there are, we could go on with letters. As Sharon said, I use the word queer. I'm going to take my language. I'm just, and I don't use it extensively just because Sharon said some older folks don't like it, but I'm an older folk and I'm not in that category.
I do feel uncomfortable like if I would say the N word, using the Q word because of how I grew up, that was derogatory towards somebody who was different than me.
Yep, and thanks, Chris. I think that just like I feel I have no permission to ever use the N-word, even if, for me, even if someone says it's okay, it's not for me. I would say if you are not LGBTQ plus, I would use the word if someone made it very clear to me that that was their strong preference. But otherwise, I wouldn't touch it.
Mhm. Yeah.
I just want to share an experience. I am just about the same age as you are, off by a year or two. I joined the Army in the late 70s. And although I knew gay people in college and also in high school, when I joined the military, I was in the medical end of things. I couldn't believe the percentage of healthcare professionals that identified as LGBTQ. I mean, a lot of people. I don't have a percentage, but much greater than in the civilian world was at least my experience. And this was, of course, before Don't Ask, Don't Tell, it was illegal or whatever the correct term was in the military.
I worked in a doctor's office and we had a lot of LGBTQ folks in our practice. And to keep their identity that they wanted to keep secret from other providers, a lot of them were turned away. And we had a transgender woman, and to get her a colonoscopy was very difficult in Wilmington, North Carolina, because we knew what doctors would turn her away. And so there is so much involved when they seek medical care, like a woman who lives like a man comes in and everybody in our staff would, oh, okay, he's a man. They look at him and he's a man, but he would come in and have to have a pap smear or a breast, have to have the breast exam. And we had to be very, very careful who knew that because we didn't want to lose their trust. So, yeah.
Yeah, if you read the News and Observer in Raleigh, you will see an article today about a young person who was going through the TSA checkpoint. And she's living as a girl, has a penis. And you may not know that when you go through TSA checkpoints, they look at you and then they push a button that says male or female based on what they see. And that changes the configuration of what they're looking for. What they saw caused them concern because she had things in areas where they didn't expect girls to have them. And they were going to require her to do a strip search and view her genitalia. That was against policy. They were going to do that before they would let them pass through TSA. Her family has sued. That's just an example. There was also, Sharon and I were doing a workshop for the Southern Gerontological Society, and there was a speaker there, a transgender woman who's a college professor in Virginia, and she had a wonderful story where she got called by her doctor and said, "We have discovered a growth in your lower abdomen. We need you to come in immediately. We're afraid you have cancer." And she told them, "No, that's my prostate." And by the way, I think Sharon and I recognize when we get into areas of transgender, gender expansiveness, gender nonconformity, for many of us, it becomes a more complex thinking about sexual orientation and gender. So I realize that we may be stepping into areas that for some folks, it's like, I still don't get it. And we understand that. Sharon, I'm going to go on mute so you can finish up our program.
All right, well, we really have enjoyed being with you today. Thank you so much for inviting us. And hopefully we can continue this discussion and make some contacts with some of you individually going forward.
Thank you very much for your presentation. And I do believe that with the information you provided, that there could be definitely people from this club contacting. And the other thing too is we're always looking for service projects. And I don't know if there's something that we can do right now where, as you can tell by the age of a majority of us, some are not there yet. We're back in quarantine with the craziness that's going on. But if there's something we could do to help with the information campaign or whatever, think of us. And, you know, we would definitely go ahead and bring that forward to our members. And those are, we've done some things. Some of us have done some writing things for Moms Rising. Is that what it's called, Chris? So yes. And I'm going to turn this back over to Teresa. So she has the floor.
Yes, Suzanne, did you have a question? Oh, okay. And please also follow us, our website or our page on Facebook where we post subjects or, you know, our upcoming speakers, if you'd like to join us for future meetings. If any other topics interest you that are coming up, we'd love to have you back.
Great, thank you.
Thank you. All right. So, is it there? Sorry, I wasn't clicking enough. All right, well, we have a couple certificates for you. Okay, need to move this, sorry. To Sharon, and we have one for Joe as well. Certificate of appreciation for presenting to us today from Rotary E Club of Social Justice, and I'll email you copies. There's one for Joe. Just a few announcements.